morning. My name is Mavis. How are you?
I'm good. How are you?
I'm going to be your nurse today. I'm going to be washing my hands. And while I wash my hands, would you please tell me your first and last name?
Maria Rivera.
And what's your birthday?
October 5th, 1997.
Okay. I'm going to be performing a cardiovascular assessment. It involves the assessment of your thorax, respiration, and breath sounds and any abnormalities I might find in those areas. It does involve some touching. Is that going to be okay with you?
Mm-hmm.
Okay. Do you feel comfortable and safe here?
Yes.
All right, amazing. I'm going to ask you some crazy questions as part of the assessment, okay? Do you know where you are?
Yes, in the clinic.
Amazing. And do you know what day of the week it is?
Monday.
What's the month?
September.
Good. And who's the president?
Trump.
Amazing. So the patient is alert and oriented to time and place. The patient has proper hygiene, proper speech to the situation. And it has proper posture. So moving forward, I'm going to assess the skin color. When I'm looking at your skin color, I don't see no cyanosis, no discoloration, no bruises, no bumps, no lesions. It looks normal and symmetrical to both hands and feet. Let me see both of your feet. Very good. Very nice. Let me see your nails. No cyanosis on your nail beds. Very good. So I'm going to inspect the shape of your thorax. So when I'm inspecting the shape of your thorax, it looks symmetrical. It doesn't look protruding. It doesn't look like you're in a tripod position. You're breathing normally. You're not using any the use of any accessory muscles to breathe. Your thorax looks like it's inflated and deflated symmetrically and evenly. I'm going to go ahead to take your respiratory, your pulse, okay? So can I just take your radial pulse? All right, amazing. So your respirations are also 18 and your pulse is 68, which is normal. Anything 60 to 100 is normal, and your respiration at 18, it's also normal. And like I said before, you're not using any accessory muscles to breathe, breathing normally there's no labor breathing. Are you having any trouble breathing? Okay. Any cough? There's nothing noticeable, but are you having any cough some other time? Do you have any concerns? Okay. Do you use oxygen at home? Okay. So I'm going to palpate the expansion of your thorax when you are breathing. Would you mind please standing up for me? Okay, thank you so much. And can you breathe for me? And again. Very good. And we're going to perform tactile firmness. I'm just going to move your hair. Thank you. Repeat 99 for me.
99.
Again.
99.
Again.
99.
Again.
99.
Very good. So the vibrations are symmetrical. I don't see any increasing or decreasing vibration as I move through. So that is a normal finding for the tactile firmness, and the thoracic expansion was also symmetrically when she was doing that. Since I have you back here, I'm going to auscultate breath sounds in 8 different places in your posterior thorax. So I'm just going to ask you to breathe normally for me. Okay, and now 2 areas over here under the axilla. And again. Very good. And 2 areas on this side. Very nice. One more time. Very good. So with your breath sounds, they are symmetrically evenly. I don't hear no crackles, bronchi, wheezing, no rub. Your lungs sound clear in inspiration and expiration throughout. So that's very good. I'm going to auscultate your lung sounds, in your anterior thorax as well, okay? So I'm going to also auscultate in 8 different points. If you can lean this way for the camera. Thank you. So here at the clavicle, Very good. 2, very good. Okay, very good. And again here. I'm sorry. Okay, very good. Okay, so over here, excuse me. Okay, and over here. And over here. Very good. Again, no problem with your breath sounds. I don't hear any abnormal sounds. It sounds clear. Both of your lungs, and inspiration and expiration. And you said you didn't have any trouble breathing. Okay, so that's very good. I'm gonna also palpate your anterior thorax for a for HAVE or thrill. This let us know that sometimes there are murmurs that are palpable, and they'll make a thrill. So I'm just gonna palpate over here. Okay, and over here, excuse me. Okay, and again, and over here. Let me see. No abnormalities there. Okay, there we go. I don't feel any vibration on your thorax, so that's very good finding. So I'm going to go ahead and auscultate your heart sounds in the different spots. So let me listen. So there's the pulmonic on the right side of your chest. The aortic, left side of your chest. Very good. Very nice. Okay, excuse me. Very good. Heart sounds normal. I don't hear any murmurs. I don't hear any abnormal sounds. So that's very good. I'm just finally going to auscultate your carotid pulses one at a time. So you can look up for me. Very good. I hear nice and smooth. Very nice. And I'm just gonna listen to your carotid pulses for a minute with the bell of my stethoscope. Okay. All right, very nice. So there's no bruit in your carotid pulses. A bruit would indicate a disease of your a cardiovascular disease, and I don't hear any bruit at this time. So that is very good and normal finding. I don't have any other assessment for you, any other tests to perform. But do you have any questions or any concerns at this time? Okay, are you comfortable? Very nice. So here's your call line and your personal belongings. You call me if you need anything. I'm gonna go ahead and wash my hands and exit the room. Okay? Okay. Thank you so much.